Welcome to the Sykes & Company PA video blog featuring Ollin Sykes.
The stores that are available for sale are fewer and far further between in today's environment because the big box retailers are not expanding. The pharmacy schools are still pushing out more pharmacy candidates than are really the market should allow. And the boomers are not retiring as fast as the millennials want them to. So it's pushing the millennial pharmacist who wants to be in the entrepreneurship ownership program into pressuring themselves of whether they consider a startup if they can't find a transitioning pharmacy.
We talked a couple of years ago, and it was pretty clear then that buying an existing pharmacy was generally a better option than a startup. And it seems like that has shifted. Has that changed in the last couple of years?
Rachel, I wouldn't say it's a last-ditch situation. I can tell you that I strongly suggest that a potential millennial pharmacist look at buying an existing store because it doesn't take that much cash to get involved in these transactions. I've seen as little as $25,000 we can put into a transaction on a down payment to buy a $6 million retail store. So, yes, you're incurring a lot of debt, but what you've got is existing cash flow. And pharmacy is all about cash flow. It's not about collateral-based assets because they're little or you have relatively few assets in a pharmacy other than inventory, receivables, and a little bit of equipment. It's all about cash flow. And the more cash flow you've got, the more you can increase that cash flow through increased revenue, increased margins, or reduced expenses, or a combination of all the above. The quicker you can generate cash flow to pay down that indebtedness versus if you do a startup, typically you want to have at least $500,000 of debt and or equity capital available. You got to have the absolute right location. You need to be profitable within an 18-month time frame, and you've got to make all the right choices about that location, about that wholesaler. And our experience in recent years is some of the startups that we're seeing, and we are seeing more startups for the reasons that I mentioned earlier, is that they sometimes go into marketplaces that they haven't fully vetted well enough, and they don't grow as quickly as they want, which means there's a cash flow drag and loss process that continues on much longer than they ever dreamed it would. And, of course, the single largest thing you can make a mistake about if you're doing a startup is not having all your third-party insurance contracts in place prior to opening. You absolutely don't want to open a pharmacy in a startup arrangement if you do not have these contracts in place because it can be absolute chaos. You have one opportunity sometimes to service patients, and if somebody walks in and you can't run Caremark or Humana or Express Scripts or whatever the case is, and that's usually what takes the longest, then you're sunk because they probably aren't coming back to visit you.
And if I'm looking to open a pharmacy, either by buying or making a startup, how long should I look for a pharmacy to buy before I start considering a startup option?
Well, it depends on your marketplace and the region that you're in. And sometimes, people want to be in a particular geographical area within 25, 30 miles of their house. Sometimes they don't mind moving. Sometimes they don't mind driving an hour. There's a lot of factors that go into that. But I think you've got to give it sufficient time, and you've got to be willing to take a look at a wider geographical area as you need to be to find that potential transitioning store. And the best way to find one is go visit the stores. Get in front of the pharmacy owners. Ask them, are they willing to consider a purchase or a sale? In this case, a sale. And if they say no, then maybe go back 6 weeks, 2 months later, ask them again. Because I find those boomer pharmacists, once they make up their mind, they're ready to sell, it's the last person that comes to them. And so if you're not in front of that pharmacy that you would prefer to own the most without bothering them, asking them are they willing to consider a potential exit from the pharmacy, you may lose that opportunity because somebody else may beat you to it.
Thank you for joining us today. If you want more information or have any questions, please feel free to contact Ollin directly.